Hi Prasoon, good to have you back on Foodyoga Nutrition Talk. How are you doing?
I'm very well, Ankush. Thank you so much. How are you?
Good as well. So today we have a question from one of the viewers. She's an interior designer and has posed a question regarding some cervical problem she's facing. And she says she does this sitting job, and there's no workout, and her nutrition. She does take supplements, she mentioned, but she's not sure about how her nutrition is doing. So, what is your take on that?
So, Ankush, I think this is a very prevalent problem that we see in a lot of our, uh, I would say, clients these days when we do the food yoga consciousness program with them. And actually, what happens is that, when we are younger, so let's just kind of get into a little detail about our physical body system. On the structure side, we have our bones, and on the movement side, we have our muscles. So these are two primary parts or the components of your body. Obviously, there are like other many hundred components of your body, but when I talk about the primary structural components of your body, these are the two primary components of your body. So when you are young, they are like building up. You can still kind of work on them, you can build them. But as you actually start growing and you start aging, when you are into your early 30s, late 30s, early 40s, late 40s, depending on the kind of lifestyle that we have, the muscles and the bones will start behaving in that way. So what happens is that gradually, if you don't work on our muscles as we grow up, then what starts happening is that the load of different parts of our body, it starts actually getting transferred onto the bones. While the bones are not designed to take any load. So in our body, the bones objective is to give the structure to your body, and the muscles are basically transferring the load from one point to another. But because our muscles are weak, what happens is that the entire load, so if we are talking about the cervical part, the load of the entire neck, we are moving our neck, we are actually sleeping, the neck actually goes from one position to another. So when we are actually doing all these movements, and if the muscles are not strengthened in the cervical part, what starts happening is that the entire load starts getting transferred to your spinal cord, the spinal system, the cervical system. And what starts happening is that gradually the bones start crushing. The bones start getting crushed with that load. And when the bone starts crushing under that load, the entire load gets transferred to the nerves that are basically in between these, bones, or I say the different disc of your spinal cord.
Okay.
So that is what we generally say as a cervical problem. But the good news is that till this problem doesn't cross a critical mass. When I say critical mark, the critical mark means that till this problem is only occurring once or twice, and it's very early stages, you will be able to easily get out of it in about 15 to 20 days and 30 days by using very minimal outside help in terms of physiotherapy and other stuff. But this should actually come as an awakening sign for anybody who experiences such pain. So if there is anybody in his early 30s, late 30s, early 40s who experiences a sign of cervical, this can happen to anyone at any moment, while you are sleeping, while you are awake, while you are working, it can occur. But once it occurs, you have to be extremely cautious that now you need to really work on improving your entire balance of this part. So when I say balance, it's the muscular and the skeletal balance.
Okay.
And what you need to do is basically have a right combination of food and nutrition.
And so, what food and nutrition will you suggest
So
for
yes,
this viewer of ours, of course?
So we have had these people who have come to us, and I think we have been very successful in kind of helping them, because I think a lot of these people had come to us in very not that late stages. And when somebody comes, somebody realizes that the problem is not very late. What happens is that by improving on your muscular system of your cervical part, using some of the specific yoga asanas. So what happens is that some of these asanas where you actually hold your head backward, something like this. What you just need to do, you need to hold. What people do is, people tend to move a lot. People don't focus on holding a lot. But I tell the people that even if you're sitting in your chair or when you're working, take out 5 minutes, just 5 minutes at about 2 hours interval, and just hold. So hold it at the back, hold it in the front, hold in the left and right, and at every position hold for about 2 to 3 minutes till you don't start feeling uncomfortable. This is the first step. But then gradually you need to subscribe to a better trainer who will actually help you with strengthening this part. In our Food Yoga Consciousness program, a lot of these expert trainers that we have on board have specific set of yoga asanas that they help people with, which actually helps people with the specific cervical issues. But it's not just yoga that will be helpful. You need to complement it with the right nutrition. So when I say right nutrition, the diet has to be based on the 6 elements of yogic wellness. I think we have already talked about it. We can, the viewers can actually go and watch the 2 minutes video that we have created about the 6 elements of yogic wellness. At the same point of time, we need enough calcium. Our skeletal system, our bones, and specifically in the case of females, they tend to lose the bone mass as they age. So makhana, which is basically the antioxidant makhana, the most powerful antioxidant on the planet that we've been talking about, it has calcium which is twice as good as the soy milk, if you do gram to gram comparison.
Also, sorry to interrupt. Also, I heard if you add 13 magical yogic herbs, it really enhances their performance.
Yeah. So of course, so all these herbs actually, they work as catalyst, and if makhana gets combined with a lot of these herbs, then whatever properties that makhana has, they only enhance. So if you actually go about taking a makhana as a post-yoga snack, it will actually elevate your experience of doing the right, or of combining the right cervical focus yogic exercises with the cervical focus yogic nutrition. You can also check out Sattviko's food yoga meals, which are actually based on the 5 elements of a yogic diet, and a combination of some of these products along with the natural products that you can find in a grocery store nearby, along with all those fresh and natural products. If you combine the right yoga meal or makhana, I think it will really add to your entire experience of improving your cervical balance. And gradually, I can say in about 15 to 20 weeks, you will start seeing those results, which will be irreversible till the point of time you are continuing that practice.
Okay, so what you're essentially saying is, for the viewer, that she needs to first do yoga and probably start holding the poses which strengthen her neck, then add food which is rich in calcium like makhana or Sattviko's meal, and then also some generic calcium supplement sort of, or can she do away with supplements? And because she mentioned that
food is the only supplement that we need generally, Ankush. I think at Sattviko, all of us have a philosophy that food is the only medicine in the world. You can quick fix your problem. If you have a pain, you need to have a painkiller till the point of time pain gets bearable. But to have a right solution, a long-term solution to any problem, I think food is the only way. Our bodies are so scientific that you don't need anything except the right food to help these bodies actually live happily and healthily forever.
Okay, so winding up, yoga and makhana will solve the problem. Thank you, Prasoon. Thank you for your time.
Namaste.
Namaste.
Thank you so much.